So, when you are at the last in the session, it is very difficult to hold the audience. But after this electrifying session by Swamiji, I feel that I could hold you for next few minutes. So the good news is that I'm not going to take a lot of time of yours. I will try to wrap up as soon as possible. The reason is very simple because I could see that my fellow panelists has already talked a lot about the CSR, different components of the CSR. Swamiji has already talked about the bitter truth, which I also acknowledge that, which is the fact of the life. When you talk to anyone in terms of the CSR, most of the people will talk to you in the sense of it is more like a checklist for the organization. So today I'm not talking about what my organization is doing about it. I'll be talking very differently. So before I start my discussion, I put my points. I formally want to thank Dr. Garg and his entire team for inviting me in this innovative event, and also to thank him for inviting a very diverse panelist during the course of the day. So a lot of thoughts have come together, which is thought-provoking. So first of all, I wanted to highlight few of the things. We are talking about the CSR, and we all understand that CSRs are putting some impact, positive impact in the society. CSR has a broader perspective, but today we are talking from the healthcare perspective. And even in the healthcare perspective, we understand that it is a very wide spectrum. So I will not go more in detail about the wider spectrum of the healthcare system, but I will talk about CSR in access to medicines. This is what I feel that it was missed out during most of the discussions, and that is why I thought to bring it up here. The reason I'm saying why it is important. We all know that a lot of funding has been done in the CSR. The first challenge is that everyone is working in isolations. Most of the company, including mine, I will also acknowledge that. Everyone is working in isolation. And that is the reason when you look at the complete patient journey, currently I'm talking about just for the healthcare and in the treatment journey itself. So when we look at this journey, we could see that only bits and pieces are matched by some of the companies. Somebody is taking care of the infrastructure part, somebody is taking care of the awareness part, somebody is taking care of more about the diagnosis part, but majority of the places you find the treatment part is missing. So today, if you are able to establish a big infrastructure, we are able to educate a patient, we are able to do diagnosis, but end of the day, if you are not able to provide the medicine for the patient, so you can think about those situations. So all our efforts has gone in vain. So there is a need of bringing a complete end-to-end solutions, which will help a patient to get the treatment right from the diagnosis to the awareness and to the treatment. And this is not possible by an individual or individual organization. Currently, what I feel that CSR is more about in isolation working. So I will request Dr. Garg, if I don't know whether it is possible or not, but if it is possible to bring a public-private partnership model where most of the companies, they can collaborate their funding at one go, at one place, and decide this is the entire journey of the patient. Here we need about the infrastructure, here we need about the diagnosis, here we need about the awareness, and this is what the medicine which is required. And as a team, we are able to help out this society. So if you are looking forward, definitely as a team, we can explore the possibility of collaborations. I will give you one example why I'm coming to this conclusion, why I'm talking about this. The rare disease. I don't know how many of you know that Government of India or India is among few countries who has introduced rare disease policy. So in the world, if you talk about any of the countries, only few countries has this rare disease policy, and India is among those. So in 2021, Government of India has introduced rare disease policy. Although it has some challenges because we do not have the lot of insights. That is the reason government could not build a very comprehensive policy. But I can assure you that it is almost 90% fulfilling their aspirations. It is giving some directions. The only challenge is that government was not very clear how many patients is coming up. And they have launched their portal where the patient was supposed to enroll themselves. So, I don't know, how many of you know that how many patients would be enrolled in this portal? Anyone, any guess? So just to give you insights, it is approximately 50 to 1600 patients. So currently the provision for helping these patients is through CSR. Do you know how many patients would have been benefited out of this CSR? Any guesses? So currently no patients. So we know that Dr. Kanchan has talked about the kind of funding which is coming into the CSR. Even after so much of CSR funding, we could not help out these 1500 patients. So this is just one example. Why I'm talking about it, because we are working in isolation. So I just wanted to rephrase that. Can we come together? Can we collaborate to bring a comprehensive solution, which is end-to-end solution for our patients? So this is not about the thoughts. It was just to trigger your thought that there is an opportunity. We should come forward and take a lead towards helping our society, helping our people. And we are very different than the global world. And we should have our own customized solution for our people. So thank you very much.